The highly contagious norovirus is circulating at pre-pandemic levels more often in school kids and travelers. And with spring break approaching, CHI Health is sharing information and best practices. 3 News Now's Aaron Hegarty has that heads up.
Norovirus is very contagious, and it's been in the headlines plenty before when Chipotle paid a fine over outbreaks, and when the highly contagious virus spread across what were perfectly enjoyable vacations on a cruise ship. Highly contagious might remind you of that other virus we first started talking about around 3 years ago. But the similarities stop there. The symptoms of norovirus come out another direction, most commonly vomiting and diarrhea, not really respiratory symptoms.
Norovirus is more active during the winter months, and we're right in that time frame.
CHI is spreading the word before students have spring break. Here's what you should know.
It usually only lasts about 1 to 2, maybe 3 days at most. So it's a pretty quick turnaround time. Even though it's kind of a self-limited infection and disease, it can lead to potentially more dangerous symptoms if it's not identified early and it's not treated appropriately.
That's because those symptoms can easily lead to dehydration, and you should head to a doctor if you can't keep down fluids despite the fact that you're really trying to stay hydrated. So how does it spread? In short, not washing your hands.
This is your good old washing hands with soap and water. Norovirus is not killed by alcohol-based cleaners.
She said bleach or chlorine-based cleaners will disinfect surfaces. Douglas County reported over 300 cases last year, a big increase from the year before. But there's a catch.
We don't typically test for it, and by the time we get the test and it comes back, they're usually over it already.
20 seconds of hand washing could spare you from this nasty bug. Aaron Hegarty, 3 News Now.
Douglas County Health says there's been 78 known cases so far this year, a third among kids 4 and younger. Because it's underreported, leaders are looking at how to monitor norovirus more closely.